is going to say to this wife of his, hop into bed because I just paid for this Viagra pill and look at the erection that I have. He didn't do the dishes last night. He didn't bring her flowers. Seriously speaking, the relationship might not be like it should be.
Back with the iconic Dr. Ruth Westheimer answering your questions on our Sex and Relationship Wednesday, and we were finishing up with Susie. Susie, are you still there? Susie. I call her Susie still there.
The important thing for Susie...
Go ahead, Dr. Ruth.
The important thing for Susie is to know that there is nothing that she did wrong. These problems do occur, and she should go to a therapist, and then she should go out and find herself a new relationship.
Fantastic. Yes, it does happen a lot, and again, I'm with you, Dr. Ruth. Encourage people to be very honest about their sexuality because there's tons of support out there. Tons of it. Find people who've been through what you've been through. Don't go it alone. Amy in Indiana. Amy.
Hi, Dr. Ruth, Dr. Ruth. I'm so excited to talk to both of you.
Excellent.
I've been married for 28 years. My husband and I tend to go through cycles, and we've done this for years, where, you know, he's in the mood, I'm not, I'm in the mood, he's not. Then we'll both hit, and we both are, and then we both won't be. That's normal. And then the other question is, why is it that a woman's vagina is like a magnet to a man's hands? I mean, there's no other part of her body that exists. That's it.
Okay, now Dr. Ruth, I'm fascinated to know if you and I will have a different way of looking at this, but you go. Have at it.
Okay, first of all, wonderful that you have a good sexual relationship. Sometimes, if you don't feel aroused, if you don't feel sexually aroused at the same time, I tell you a secret. Give him an orgasm. It takes 2 minutes. It's not a big deal. Give him an orgasm. If he only touches your vagina and forgets about your nose and forgets about your breath, you have to teach him. You have to take his hand and you have to show him what you need on your belly, on your behind. Show it to him. Don't expect him to know it by himself.
Oh, Ruth, you have
okay?
we got to drop pamphlets across women in America from your sage advice. But the other thing, Amy, I would say the reason he goes right there is that one of the big mistakes, and Dr. Ruth, you ring in with me on this if this is true, you think so, that men and women assume that what they want is the same as what their partners want, and men typically want their female partner to go pretty much right where the action is, and so he assumes that's where you want to go. You need, Dr. Ruth said, you need to educate him about how the female erotic responsiveness works. Yes?
And that it takes a woman a longer time to be up on the curve of sexual arousal.
Yes.
So don't make a big dissertation about it. Don't talk about it. Take his hand and show him what you need. You have to take the risk to show him what is needed for you to have an orgasm, okay?
I think she's got it. Tiffany in Oklahoma. Tiffany, you got something for us?
Hi, Dr. Drew. Yes, I've been married for 5 years, and I've been separated for about 1.5 years now, and now I'm in a new relationship, and I'm wanting to know, like, why is it that I can't orgasm with my new partner?
Dr. Ruth?
Okay, I cannot answer that. I would have to have you here, and I would have to ask you many questions. But I have to tell you one thing that I think, if I can just take a guess, maybe you still think about that first relationship. Maybe you are still upset that that didn't work. So my suggestion to you is to make sure that you are relaxed, make sure that you concentrate on the thought of the new relationship and not bring the old relationship into bed with you. Maybe sometimes what helps is a glass of wine. Now, I just came out with a wine called Vin d'Amour, Wine of Love, and it has only 6% of alcohol. Drink it because it will help you to relax. The best thing would be if you both drink it. Good luck.
Now, one quick thing I got to ask you, our previous caller, is are you taking any medication? Sometimes in this day and age when people are on so many pills, it's as simple as that.
Well, I'm not taking any medication. Like, I've tried, like, Damiana.
No. Are you taking medication that could be blocking your sexual performance, your libido?
No.
And you're not, no new birth control pills?
nothing.
Okay, people often don't think about that, but that can, medication, birth control can very much get in the way of sexual arousal and orgasmic function. Okay, let's go to Roland in California. Roland, what do you got?
Hey there, Dr. Drew. How you doing today?
Wait, take a second, Roland. Dr. Ruth wants to make a comment. Go ahead, Dr. Ruth.
I want to make a comment to Drew. Drew, this is why it's fantastic that you, I did my homework on you, that you are a medical doctor and that you can right away ask about medication. For me, I would have to say, go and see a medical doctor, go and see a gynecologist.
Right.
That's a wonderful way of you are combining the issue of medication and sexual arousal.
I appreciate that. Thank you, Dr. Ruth. And Roland, go ahead there, my man.
Okay, fantastic. Well, pleasure, Dr. Ruth, to speak with you. And what I have to say is, as Romance Awareness Month comes to an end, I often suggest to couples that they should have some form of intimacy daily and stay connected to maintain a healthy relationship. What are your thoughts?
Romance Awareness Month?
Okay.
Tell us a little bit about that before we answer your call. What was that?
Very nice.
Did I know
Very nice. I wouldn't say daily, but I would say maybe every other day. But very nice because that keeps the relationship going. Bravo, and I'm very glad we had a male caller. Good luck to you.
Roland, so what did you say about Romance and Relationship Month? Tell me about that.
Yeah. August is Romance Awareness Month, and it's an excellent time for a lot of couples to kind of reconnect, where it's not like Valentine's Day where you have the one day, but it's kind of reconnecting with your partner, and it happens for the whole month of August.
All right, Roland. Thanks for the call, Dr. Ruth. Thanks for the... Go ahead.
Especially when it's hot and you can sleep naked. Wonderful.
Especially when you can sleep naked. Those are the years of training. Dr. Ruth, stay there right there. We're going to get more to these calls and more of Dr. Ruth, plus two of my Sex and Relationship Wednesday favorites. Siggy and Emily are standing by to join us. And later, of course, I'm going to check in with Jared Bro, who was on our show last night, hear the latest about Hurricane Isaac. There he was from last night. Hopefully he'll give us a similar view tonight, and so we can understand what it is really like on the ground there. Be right back.